welcome. I am Naveen Agarwal and I help medical companies build safe products through a quality system that's agile, compliant with global regulatory requirements, and focused on the needs of patients and stakeholders. I've created this video as a resource for you, but my goal is not to just bring you information. Rather, I'm focused on getting you deep insights based on years of industry experience. So call me or email me with your questions and let me know how I can help you. In this video, I'm going to talk about a recent recall and what we can learn from it. In June of 2019, a major distributor of the Baby Dot Plus pressure relief manifold issued a recall of about 15,000 units from different lots distributed over a period of 8 months. Now, this is a product that's used in a breathing circuit that provides life-critical breathing support to infants. Recently, FDA classified this as a Class 1 recall, which is the designation reserved for the most serious type of recall. So we want to look at this in detail to learn some lessons for our quality management system. Keep in mind that recalls are very common in the medical industry. And just because a recall has been announced and classified as a Class 1 recall does not mean that patients have been harmed by this product. And in many cases, manufacturers issue a voluntary recall as a preventive measure to make sure no one gets hurt from the product in question. So on the surface of it, it may sound like a bad thing, but a recall actually is a very timely action to protect patients. Now we know that recalls can be very expensive, both in terms of direct cost and indirect cost. So what we really want to do is learn from this particular incident to see how we can improve our quality management system. At the end of the day, the effectiveness of your quality management system is determined not by how many procedures you have or how big your quality management system is determined by the ability of your quality management system to detect problems before product ships out of the door. So let's take a closer look. First, we want to learn a little bit more about this specific product. The Baby Dot Plus pressure relief system is part of the bubble CPAP breathing circuit that's used to provide controlled flow of humid and warm air to the infant's lungs, where the infant may be having respiratory problems. CPAP stands for continuous positive air pressure. And the valve inside this pressure relief system is designed to relieve excess pressure if there is a blockage anywhere downstream in the system. So from this point of view, it's a safety critical feature. This is not a new or complex technology. Here is a summary of the 510(k) clearance for this particular device. FDA cleared this device in 2011 based on a predicate device cleared in 2004. And that particular device itself was based on a predicate from 1983. So this technology has been around for a while and being used in different scenarios. So what went wrong in this situation? In June of last year, the manufacturer became aware of 2 reports of malfunctions with the valve. And what they heard was that the internal components of the valve were not sitting well on the valve seat, thereby effectively creating a leak. And as a result, the system could not maintain the positive pressure required to deliver the controlled flow of air. As you can imagine, that this can cause a lot of harm to the infant patients who are already at high risk. The FDA has determined this to be a design issue. That's a very high level assessment. Doesn't tell us much more than that. Now, it's not our intention to try to solve this problem at this point. What we want to do here is ask some fundamental questions that we can use to learn a little bit more about the weaknesses in our quality management system that we can fix from a holistic perspective. Is this a new risk? It is possible that this type of a malfunction was not known before and may be a complete surprise to the manufacturer. In the language of ISO 14971, this could have been a hazardous situation due to a sequence of events, whether related to the device itself or the way the device is connected in the overall system. And these type of hazardous situations can expose the patient, the infant patient in this case, to significant harm. Now, it is not expected that the manufacturer will have every possible scenario listed out because we don't know what we don't know at a time. But it is expected that a list of hazards, hazardous situations, and harms will be compiled, maintained, and updated as new information becomes available. So the question to ask is not if it's a new risk. The question to ask is, do we have a process to capture information and evaluate to see if there might be a new risk that should really make us go back to our system and evaluate that to add it to our list of known hazards, harms, and hazardous situations. So this is an opportunity to take a look back at our system of post-market surveillance and see if we have a process in place to identify new risks and assess them properly so that we can update our risk management system. How well do we understand our product? It is highly unlikely that the risk of harm to infant patients because of low airflow or low oxygen levels was not already captured in our risk management. What's more likely though is the relationship between this particular problem with the valve of not sitting well on the valve seat and the impact of the loss of pressure in the system. That information may have been missing. In my experience, engineers do a very good job at failure analysis. They may use tools like failure mode effects analysis or FMEA. They may use fault tree analysis or HAZOP. All these tools are great to understand what can break in the system. But they are not particularly good at relating those failures to hazardous situations and potential harms. Doctors, on the other hand, are very good at understanding hazards, hazardous situations, and harms. So it's the relationship between these two types of analyses which is often missing. So what we have to do again is to go back to our risk management process, all our failure modes or engineering analysis tools, to see first, have we identified all different failure modes? Maybe this is something new that was not listed there, so we should add it to it. And then secondly, do we have a process in place to connect those failure modes in an accurate way to hazardous situations and harms? And you may have to use completely different tools for that particular purpose. I have seen people use engineering risk analysis tools like FMEA for the purpose of hazardous situations and harms, and it doesn't go very well for one reason or another. In future videos, we'll talk more in detail about this particular topic. What additional controls should we expect? It is very interesting to note that in the recall announcement, it was said that it's very easy for a user to visually inspect the device to see if the valve is sitting properly, or to connect it in a net circuit and test it prior to use to see if it will hold pressure or if there is any leak. Again, in the language of ISO 14971, this would be referred to as a control at the user interface. It's an information provided to the user through a user guide or instruction for use or direction for use, but it relies on the user doing something. It's a least effective control. It's important, but it's the least effective. What's preferred is to implement controls either through design or through our manufacturing process, which can detect these potential problems early on before the product is shipped out. So again, the question to ask here would be, what additional controls we should expect in our risk management system? Do we have enough? Do we need to implement any controls in our supply chain, either through people who provide components for this valve, or they might be doing some service, maybe a sub-assembly? So we need to look at, from start to finish, where appropriate controls should be implemented. User controls are important, but only in a way the last line of defense. In conclusion, this recall happened because of a specific issue with the valve in the pressure relief manifold. It was not sitting properly. But underlying this particular incident are hidden layers that we need to explore, asking these questions at a holistic level. And when we ask these questions, it allows us to look at opportunities for improvement in our risk management process, in our quality management system. It is important to connect this feedback loop from the post-market surveillance, where we get to know about these problems, to the design process, where the engineers can actually help us evaluate if we have appropriate controls or not. This is what we call the feedback loop on our post-production and production system in the risk management process. Thank you again for your interest and attention. If you like this video, subscribe to my channel so you are always in the know. Visit my website www.exceedqm.com to learn more about how my Exceed portfolio of innovative quality solutions can help you. I focus on risk management, regulatory compliance, customer experience, and quality culture. I also publish a newsletter, so check that out. It's published on a monthly basis and has links to articles on different topics of interest in our industry. It takes only 15 minutes to review those articles on a monthly basis, and it's absolutely free. So I invite you to check that out.